Welcome to Caring for Carers, a podcast series on psychosocial support and safety for healthcare workers by Nationwide Quality of Care Network, supported by UNICEF India.
A dream does not become reality through magic. It takes sweat, determination, and hard work. Hello, folks. This is your host, Neelu Suri. Welcome you all in today's podcast series with yet another story of healthcare worker. Doctors all over the world are given the stature next to God because they are lifesavers who work tirelessly for mankind. And today I'm privileged to be joined by a young, committed, and diligent doctor. Hello, Dr. Prachi Saxena, and very warm welcome to you.
Thank you so much, ma'am, for the sweet introduction. It's a great pleasure and honor to be the part of this discussion. Thank you, NQOCN, for giving me this platform, which will help people to understand how we, the doctors, are dealing with the situation.
Prachi, before we proceed to your story, could we please start by knowing a little bit about yourself? For how long you have been into this profession and what is your area of specialization? And if I talk about your family members, who all are there?
Ma'am, I'm from Kota, Rajasthan. I have done my schooling from Kota and undergraduation from Keli University, Belgaum. Now I'm in third year of residency in OBGY department at Pravara Rural Medical College, Loni. I'm married since 3 years and my family is settled in Kota and Surat basically.
Dr. Prachi, it is very much significant to know that you were amongst the first Indian doctors to encounter this huge catastrophic pandemic. Could you please share some unforgettable experience with us?
Ma'am, looking back to this past 1 year, we had gone through mixed emotions. There were many ups and downs throughout the journey. I still remember my first exposure to this virus was early in Feb 2020. There was one patient in our ward which came up with symptoms of viral pneumonia, which we found out to be COVID positive later. So the management decided to isolate that patient, and me, along with a limited number of staff, was shifted to an isolated center situated few kilometers apart from the main building. At that time, as it was a sudden wave, the system was not well prepared. And we were not pretty sure on how to fight against this deadly virus. We were still in stages of discovering the new symptoms of this virus. At that time, the system was not well prepared for such a situation because we were facing it for the first time. It was the first patient we came across. We were very anxious. The patient was herself very anxious that what has happened to her. And I was very anxious, what should I do? How can I help her? And at the same time, how can I protect myself?
Dr. Prachi, you have gone through mixed of emotions. And, if I remember that time, during that time, lockdown was imposed, though that was very much mandatory at that point of time just to curb that spread of disease. So, Prachi, what kind of, stress you had gone through that time, when abruptly that lockdown was being imposed on you?
Ma'am, as we see lockdown, it was a very necessary action that was taken by the government. I think it has been improving the situations to a certain level and, controlling the situations. But it also led emotional and psychological pressure to us. I think the pressure was not only to the doctors, I would say, but throughout the society, the pressure was there. But working in such a pressure and living in such an isolated manner without no much communication, not meeting the families, not having any group meetings, or not having any, source of releasing our stress, and only doing continuous duties over days and days because of the increased workload of the COVID patients. It was a very difficult time, ma'am.
I can understand. And Prachi, if I talk about, unique challenges, if I'm talking in point of, physical challenges or, emotional challenges or psychosocial challenges, what were those challenges?
Ma'am, as we see, the number of patients were rapidly increasing in spite of following the protocols. Even the guidelines were changing. The community was hiding the symptoms and the illness. There was a stigmatism of COVID. There were a lot of patients, overcrowding in the department. The bed availability was not there. The manpower was less. As we had to give a separate isolation ward for COVID patients, the team has to be divided. In that, the normal patients, they got suffered because the majority of the team were working in the COVID wards as it was the demand of the time. And seeing my own batchmates and faculty members getting affected through this process was very painful. Seeing getting them severe in the due course, and it was very emotionally disturbing as the entire team works as a family unit. It was very difficult to work for continuously for 24 hours duties. Our duties were increased because of less manpower, and working in that PPE kits for 12 hours straight was a challenge in these duties.
Prachi, you said that irregular OPD follow-ups were there, you was losing your patient, So what kind of, emotional stress was there? Did you impact you emotionally since you were losing your patient also?
Yes, ma'am, definitely. It was a time when we feel very helpless, you see. It's very difficult for the family member to lose patient, but at the same time, the doctor is also losing the patient. Me, in a profession of OBGY, my work is to give birth to a newborn, to help the society. And in this situation, when things were falling apart, everything was just burnt out, it was very difficult for me to see patients dying.
Yeah, I can understand. And you stated in your story that you have gone through that physical stress also because of wearing that PPE kit for hours and hours, 48
Yes,
hours,
ma'am, there were
sometimes
sleepless
24 hours.
nights, so many
Yeah.
hours there. You see, the food facilities were obviously limited in what could be provided in a quarantine hostel, obviously. But dealing with all that stress and working, overworking, I should say, and getting a limited time of rest was difficult time.
Yeah. And what other, kind of challenges you faced during that time? If I talk about your academic loss and your, specialization loss.
Yes, ma'am. COVID pandemic has disrupted the teaching and the training program of a postgraduate as elective surgeries were withheld for months together, I would say. And there were restrictions for, classroom meetings because we couldn't have group meetings. Though they're online classes, ma'am, but that face-to-face teaching and, case presentations, all that was little affected, you see. Majorly, I'll say the elective surgeries, as a third year resident, is most important part for me.
Prachi, if I talk about, psychosocial support from your seniors, support from organization at that point of time, when your own colleagues were under, that deep sense of problems and, cures was there all around. So how did they support you in that battle?
Ma'am, in these tough times, the role of the management and our seniors were the integral part, I would say. Slowly, the system, the management started to put the things in place, and there were improvement in the logistics, and the understandings of things were better. The testing facilities were improved, and by the time when the vaccines were introduced, there were mass campaigns, and people also got acquainted to the COVID approach and keeping themselves safe. So all that reduced the stress and anxiety, I would say, ma'am. And yes, when you were asking me about the support from the seniors, we definitely need our senior support because I think they were the person who were always beside us, guiding us throughout. Here, I would really like to mention my head of the department, Sir Dr. V.B. Bangal, sir. I think he was a person who was constantly giving strength and encouragement to the entire team, emotionally, and also guided us to how to deal with the situation.
Dr. Prachi, a very personal question to you now. Since you have gone through many challenges, like physical challenges, emotional challenges, but at that critical moment, what was your main source of strength which kept you going steadily?
I think the feeling of helping others, that's keep you going. And when you and the positivity you get when the patient gets cured and the blessings you get from them, I think that's what keep us motivated and help me keep going. At the same time, I would say the support of the family is very important in such situations. The support from my mother, the support from my husband, it was very important. I think they were the ones who always kept me calm. They were my stress relievers, I would say.
You stated beautifully that yes, of course, mother made a difference in everybody's life, And if I talk about blessings, yes, when patient recover, blessings make a difference again in your life.
Yes.
Being a doctor, you are privileged to have those blessings. Dr. Prachi, I'm going to wrap up this session now, but before that, I will request you to give a small message for our listeners.
I would like to convey a message to everyone who is listening to this, to stay positive. Kindly follow the protocols which are provided by the government. We have to take care of each other in the society as we all are in the same boat. And if you guys really love us and respect for what we are doing, you must follow the protocols and keep ourselves safe.
Dr. Prachi, so beautifully and so incredible words you have given, that if you really love us, if you really appreciate our efforts, then please abide by the rules and comply all the guidelines. Thank you so much, Dr. Prachi Saxena, for being with us.
Thank you, ma'am. It was my pleasure.